I'm Kristen Zaleski. Nice to see you all. And for those who haven't met, I hope you come by to visit soon. I'm in this field 20 years. I spent the last decade as a clinical associate professor at USC, the University of Southern California, in the School of Social Work. Before that, I was at UCLA's Rape Treatment Center and the Veteran Health Administration. Every aspect of my career has been spent in direct practice psychotherapy. At USC, I was hired to work in the trauma specific classes and develop coursework for the master's and doctoral level programs there. And as you would expect any clinical associate professor to have done, I have a couple books published, one on sexual trauma, one on human rights and gender-based violence, and a number of peer-reviewed research studies. While I was at USC, something I haven't let go of, even though I've now moved as clinical director to the collective, is I started the Human Rights Clinic at the University of Southern California in partnership with the Keck Med School. We provide pro bono psychological evaluations to survivors of human rights abuse seeking asylum in the United States. Out of this comes a lot of trauma-informed research that I continue to do. And I just put that out there because we're always looking for volunteers to learn how to do this and help save lives. So just a plug there. So when I came to the collective, I really was interested in coming here because I liked the model, and having had both my one foot in research and one foot in clinical, I see the promise of evidence-based practice and also the challenge with evidence-based practice. Doing these laboratory studies myself, you really pick the best of the bunch when you're trying out a lot of these manualized treatments. You tend to lean more towards heteronormative, middle to upper class, male sort of populations. These are often not the people that we're seeing, right, when we do clinical work. So I really value EBPs, and I also really value the nervous system and the research that has come out of the last decade and a half of the brain and how we heal things, not necessarily through classifications in the DSM, but through understanding the neurobiology of somebody and figuring out what best meets their needs. So the collective had a really wonderful program that I call top down meaning our human brain going into the circuitry and down into our body of our nervous system. So really wonderful group programming. Sarah Douglas, who comes also from the Veterans Health Administration, is the trauma program manager and created a really impactful trauma treatment track here. That is not something clients enter into initially. They need to enter into our emotional resiliency program, but they can move into that, which I'll talk in detail about. And so in my time here, it has really been enhancing and making a bit more diverse the kinds of therapies that are offered. As I've gotten to know the treatment center world, I'm really proud of the program we have. We have over 30 clinicians, just to brag about a few of them. 2 of them are also associate professors at USC, one of whom has multiple publications in grief work. She runs our grief group and does individual work for grief. Another one is an associate professor around trauma and psychodynamic psychotherapy. We have a clinical researcher from USC here. That's our neurofeedback program facilitator. Him and I worked on a randomized control trial on a amygdala imprinting neurofeedback software that downregulates the nervous system. It's one of 2 in the United States. It's currently being tested at NYU for going into the field and getting FDA approval, but we have that prototype here. So in addition to alpha theta wave intervention, which many of you are familiar with, we're also able to do amygdala fingerprinting and neurofeedback directly to the amygdala to downregulate trauma reactions. Jack, in addition to that, is a researcher on LGBTQ affirmative therapy. He has helped create a program called Proud and Empowered, which is actually embraced by LA and Pasadena school districts for teenagers. And so we have adapted that group modality here in the collective and are offering LGBTQ affirmative psychotherapy, both through that lens with Jack, as well as in the Proud and Empowered group. just while we're on the topic of LGBT affirming care, we have gender neutral bathrooms, we have co-ed housing. And so we really try to be as affirming as possible for people who are exploring identity. On Wednesday mornings, we have gender-specific process groups on women and men's, and then a third one for gender exploration. So really trying to allow however people want to come to explore those parts of them. So we also, this is where the nerd in me comes out. I'm going to name drop some theorists that maybe some of you have heard of. There's a well-known psychiatrist that published a book in 1992 called Trauma and Recovery. Her name's Judith Herman. She was sort of the first person that put together, hey, that thing that we see women suffer from with abusive marriages, that same thing's coming out of combat too. They're not different, they're the same. And so she really advocated for acknowledging what PTSD was. She saw sort of a three-pronged way to heal trauma. You have to find safety first, you then go into the narrative work, and then you reconnect to the world. That was already here when I came, and we have made that three-phase healing model really robust. So if somebody comes here, for example, with anxiety and depression, or somebody comes here with PTSD, the first thing we're focusing on is not necessarily that diagnosis, though psychiatry, that'll be different. But in terms of therapy, it's finding safety. Are they safe here? How do we create a supportive milieu and staff where people can trust us and begin to unpack these things? How do they feel safe within their body? How do we teach those coping skills that when they're leaning into panic attacks? So anyway, and how do you heal that in your body? And then emotional safety within their family units. So we have a pretty robust family program. We're doing a DBT family coaching group virtually every Wednesday night, led by someone else I want to brag about, Dr. Dorit Zabiri, who's an associate professor at UCLA and runs the Safe Haven program there. And then we do coaching with families and family work as soon as we feel the clients are ready, which might be right away or later. All clients are coming into our emotional resiliency track. The group programming is about half somatic interventions. We're looking at psychodrama, your yoga, mindfulness, meditation. We have Tai Chi, those sorts of things. And then the other half of the group programming are things you would recognize, like CBT in the form of unified protocol, ACT, other modalities. And then we have more topic groups like the grief group I mentioned, anger. We have a expressive and narrative therapy program here once a month. We have clients come and share with the entire milieu a poem they've done, a song they've written, a piece of artwork that they've created in our groups. We have music therapy, art therapy, and narrative expression groups, which is a pretty amazing monthly showcase that we do that takes up about an hour of our afternoon, and really see a lot of transformative work there. So hopefully I'm sort of conveying how we get and treat mood disorders.